Welcome to the Increda-Dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-Dental podcast. I'm your host, Alicia Flynn. Today, we're going to dive into how we can help that limited exam or that new patient exam to go smoother and to get them back for treatment in a more successful manner. So the first thing we want to do is we need to realize that one of the biggest schedules or appointments that are failed are the new patient exam. So we need to start at the beginning and to make sure that we have great phone skills, texting messages that encourage the patient to come in. Now, there is no silver bullet for having patients accept their treatment plans, but there are some strategies and some things that we can do to increase the likelihood of the patient moving forward with their treatment. One office we went to, they had over 1,500. There was actually 3 practices within this umbrella, and they had over 1,500 new patients the last year. 42 patients on average per month for each location. The problem is that less than half were coming back to complete or to do any of the treatment. And this was causing a lot of problems within the dental practice. So we dove into what was going wrong with this practice and what was going right. What we learned was that the front office was doing an amazing job. They were getting the patients scheduled. They were coming back for their first initial appointment, but then they weren't coming back for the rest of their treatment. So what we learned, I want you to apply to your limited exam especially, but also to your new patient exam. And what we found out was that the dentist or the hygienist was meeting the patient when the patient had already been laid back and they were on their back, which is a very vulnerable place to be in. When you meet a patient for the first time, you want to meet them where you're on level playing ground. So either where you're both sitting and talking to each other or you're standing and meeting each other. And then you want to break down that medical barrier by having a non-medical touch. So this might be a handshake or a hand on the shoulder, but something that shows that you're personable, that you're a person who they can speak to. So this was the first problem that we recognized that was happening in the dental practice that we were observing. So it's key to make sure you do that. The second thing was they weren't interviewing the patient. They weren't listening to the patient. When they told the patient, we'll just go ahead and move forward with what we think will be an exam, they just went forward and did an exam. They didn't allow the patient to verbalize what they were hoping for or what they were looking for. So it's important that we give the patient a voice, that we allow them to explain to us as medical providers, as a dental provider and a hygienist, what the patient wants. Because we can look in their mouth and see things that they need to have done, but it may not be what the patient wants. And we have to get them to buy in to what they stand in need of, but we need to address what they desire. So patients often will be concerned about how dark their smile is, or that they have black triangles between their teeth, maybe that they have sensitivity on the upper right or wherever it is located in their mouth. But if we don't give them that opportunity to speak and let us know what their top concern is, we've already turned them away because we've told them that we know better and that we're more like a command and not someone who will listen and who will help them in their treatment. So ask the patient, what is your primary reason for coming here today? And listen to them intently. Don't interrupt. And then follow up with, is there anything else? A lot of times, we only divulge a small amount of information to a medical provider as patients. And so we need to make sure that we seek out more answers because too many times we only mention one thing when really there are several things going on. Once you know that the primary concern of why they're there And if there's anything else, you can then do your exam. Now, if this is a patient who was scheduled just for a limited exam, who's there for pain, you can then offer them, we can just take care of this one spot that you were concerned about, but we can also do a comprehensive exam and look at everything. What would you like to do? The choice is up to you. So we empower the patient by giving them a choice, by letting them know we're here to help you and we can take care of that one spot, but there are other things going on and we're going to let you choose what you want. The thing about being in a dental office is that you feel like you don't have a lot of control when you're a patient. Again, you're laying on your back, you have your mouth open. It's very, very vulnerable. And most people want control of what's going on in their environment, especially what's going on with their health and with their mouth. So we need to let the patients have control of that and then be like their best friend in proceeding forward in treatment. As we gain this opportunity to listen and to give patients a choice, we can then go to the barriers and ask them, what would keep you from getting your treatment done? What barriers might stand in your way? Some people may say, oh, it's time, or it's money, or I'm worried I'm going off my spouse's insurance and I only have a little bit more time to do this treatment. So I want to get done because we're going through a divorce. Find out what barriers keep patients from completing their treatment and then help them see those barriers being dissolved. Some patients will tell you some crazy stories about being in pain, and they're true to the patient, even though in your head you're like, how could this possibly happen, right? But to the patient, they're real. And it's important that you address what's real to the patient. Say, I understand you had a really unfortunate dental visit and you were very uncomfortable and in pain. I treat many patients like you. You want to let them know they're not alone, that you help take care of other patients who have had poor dental experiences, and that you'll take care of them. If you do this, you help dissolve that barrier. So mention what you provide. If you provide nitrous oxide, pre-sedation medication, or IV sedation, mention to them what is available in your practice so that way you can help dissolve the barrier. If it's financial, mention about if there's financing companies they can work with and how you can help them work on getting their treatment done because you work with other patients with the same issue and that they're not alone. A lot of times patients feel so alone in the dental chair. They feel like they're the only one who has this problem. And as a dental provider, you can dissolve this barrier and suddenly the patient sees you as a friend, as someone who will help take care of them. I can't emphasize this enough and just want to encourage you to listen to your patient, find out first meet them the proper way, eye-to-eye contact, non-medical touch, find out why they came to see you, and then if there's anything else, invite them to come back if they only want to address the one issue, but also listen to their barriers, ask what barriers they have, and dissolve those barriers. Have your staff trained in the right answers, if you will, letting the patients know that they are at the right place for their dental treatment because you will help them with whatever barrier is in their way. Thank you for joining me. I'm Alicia Flynn.